What should you expect during your regenerative medicine treatment evaluation? Hello, this is Dr. Siddharth Dambar, expert in regenerative medicine and in rheumatology. In this content, I'll be discussing what you should expect during your regenerative medicine treatment evaluation and how you can get the most out of your evaluation. First and foremost, what is regenerative medicine? It's essentially the medical specialty where we utilize your own cells, your own body cells, your blood platelets, your own bone marrow-derived stem cells to treat chronic musculoskeletal conditions. That includes arthritis, tendinitis, acute injuries, and back pain. So if you have one of these conditions and you failed conservative treatment, such as physical therapy, rest, and you're trying to improve your pain, improve your function, get back to certain activities, sports, work, home activities, and now you're considering a regenerative medicine treatment evaluation and trying to avoid surgery, here's what's involved. First and foremost, there are some documents that we'll want and some information that we'll want prior to your evaluation. So you'll want to make sure that you bring these in or make sure that we receive them prior to your evaluation. These include any relevant evaluations you've had from other physicians. That can include your primary doctor, orthopedic surgeon, pain physician, interventional pain physician, rheumatologist, sports medicine doctor, or physiatrist. Anyone who's already seen you for this diagnosis or your problem, who has done some kind of evaluation or treatment, those records are relevant. We want to see those. In addition, if you've had any imaging, in particular from the last 2 years, we'll want to see that as well. That could include x-rays, CT scans, MRIs, or diagnostic ultrasound. If you've got a report, at a minimum, we'll want to see that. Essentially, the radiology report where the physician who has read the images has described what your pathology is, we'll want that. If you happen to have the images as well, either on a CD or a thumb drive, it's a bonus, we'll look at that as well, but at a minimum, we'll want to have the actual radiology reports. Then, when you actually come in for your evaluation, there's a number of things that we'll be doing. First and foremost, we'll want to get an appropriate medical history as to what your issue is. We'll want to know what area is involved that's problematic that you need assistance with. What's the history behind this? How long have you had your symptoms? Have you had any relevant injuries? Any prior evaluation, any other prior imaging, any other prior treatments. If you've had surgery, some details, if you recall, of what was done would be helpful as well. After that's done, we'll then proceed with a physical examination. During that physical examination, evaluating your area of interest is our focus. We'll also evaluate above and below that. So for example, if you have a knee problem, we'll also want to know what's going on with your foot and ankle or your lower back as well. If you have an elbow problem, what's going on with your shoulder or your wrist. All these things are very connected. And when it comes to determining a course of treatment, we'll want to make sure we're being thorough and treating everything that's really relevant. Part of that physical examination will be examining the joint that needs to be evaluated. We'll want to know how is the range of motion, is there any inflammation, is there any instability. The way that regenerative medicine works is by treating your instability and your inflammation to create a healthier joint, to provide you less pain, better function, and overall better quality of life. Part of that diagnostic evaluation while you're in the office may also include a diagnostic musculoskeletal examination. I'm a big fan of ultrasound when it comes to evaluating joints and tendons. Not only do you get a very good look at the actual joint, it's great for looking at tendons and ligaments in terms of soft tissue injuries. It's great for stress testing the joint and looking to see if you have any instability as well. And it's great for looking for inflammation as well. Very helpful when it comes to deciding whether you're a candidate for treatment and how we should be treating and what we should be treating. And then of course, there's also understanding what is your actual candidacy for treatment, what's your actual medical problem, are you someone who we can actually help with the regenerative medicine treatment, and in addition, what are your treatment options? When it comes to treatment options, there's a range of different things that we can do, and understanding what's the right treatment for you will depend upon that evaluation as well. And then of course, discussing your personalized treatment plan. The reality is that with these kind of treatments, A one-size-fits-all process does not work at all. What we want to be doing is looking at your particular issue, medical history, prior treatments, and goals from treatment. We'll want to make sure that we create a treatment plan that gives you the best chance of getting a good outcome. And again, determining your candidacy is partly based on what's your pathology, partly based on what's your medical history, and also partly based on what are your goals for treatment as well. Along the way, answering any questions and concerns that you have is certainly part of the process as well. And then figuring out what are the next steps after your evaluation. You may require additional imaging. After reviewing your radiology imaging, the reports, and possibly the images themselves, we'll let you know if that's adequate or if there's additional testing that we need. And then, of course, preparing you for your treatment journey. We need to be eye to eye in terms of what our goals are for treatment and what are the next steps. What additional testing do we need? How do we get you optimized for treatment as well? Are there certain medications that you should be off? Are there certain supplements that you should be on? Are there certain exercises that should you be doing prior to treatment? Are there other ways that we can optimize your treatment prior to actually proceeding as well? That's all part of your evaluation to determine and to optimize your regenerative medicine treatment outcome. I hope that gives you a flavor of what's involved in a regenerative medicine treatment evaluation. If we can be helpful in the future, please let us know. We're here to help. Until we connect again in the future, I hope you stay well, live well, and have a good day. Bye-bye.